Hello,
Hello, sir.
how you doing?
Good and you?
I'm good, thanks.
Thank you.
Since I'm going to be training you,
Uh-huh.
I just need some information regarding your lifestyle.
Okay. Yeah, no problem. So you can ask away, sir.
Yeah. What's your name, sir?
Temba
Temba. Temba.
Matibula.
Matebula. Okay. Date of birth, sir?
2003 on the 1st of July.
In what month is it?
07
Okay.
on the 1st.
Okay. I want to ask you, are you concerned about your body weight?
My body weight.
Your current body weight?
No, not currently. I think I'm fine. No. I'm still young.
Yeah, you're still young.
Yeah.
Very young, so. Yeah. Okay, so how tall are you?
My height.
What's your height?
168 centimeters.
68 centimeters. Yes, it's a good height.
Average.
Above average.
Above.
It's above average.
You think so?
Yeah.
Okay.
How often do you exercise and what exercises do you do?
I exercise 5 days a week and mostly it's soccer. I play soccer.
That's great.
Yeah. It's a passion dog.
Next question. How much do you enjoy your current training regime?
Not that much. Not that much, to be quite honest. That's because all we do is run these days. I don't know why. I think it's the attitude, the mood of my coach. He's not feeling well. I think there's something wrong within the household. So just been running every day. It's quite bothersome actually. So just a lot of cardio.
A lot of cardio.
Yeah.
So you're not enjoying it that much.
No. I want something different actually. Maybe some strength training here and there, you know.
It's nice. So you're not enjoying your current training regime that much?
Not at all. Not at all, sir.
Don't worry, we're gonna fix that.
I hope so.
So how consistent are you with your training?
Very consistent. I train every week, every day. Not a minute wasted when I'm training. Even though I'm not enjoying it, but I do everything.
So you're very consistent.
Very consistent.
That's great.
Some even call me a junkie dog. They call me a junkie, a training junkie sometimes.
Oh, a soccer fanatic.
Yeah. Yeah, I couldn't have said it better myself.
So, how do you spend most days being inactive?
Or when I'm not training. When I'm not training. Mostly sleep, and after sleeping, watch movies.
Do you experience any side effects from any medication?
Medication? Like any kind of medication that I take?
Yeah. And you take any kind of medication And you
No,
suffer from any side effects from the medication?
no. Even when I have a cold, there are no side effects when I take my medication, so I'm good. No side effects at all.
So you aren't taking any medication?
No, only when I'm sick. Only when I'm sick, like flu and cold and stuff.
And do you drink alcohol, sir?
Only on occasion, sir. On
How
occasion. Often, like once every 2 months. Once every 2 months.
Once every 2 months?
Yeah.
And how much do you drink?
I don't quite measure it, but about, what can I say? Three dumpies. I don't know how much that is.
So, 3 beers?
Yeah, like 3 beers, most at most.
Okay. Okay, let's see. Okay. Do you ever feel like you must reduce your alcohol intake?
Yes. Yes. Because I don't want to have those kind of bellies, you know.
The beer bellies.
Yeah, the
I see
beer
that
bellies.
one.
I don't want to have those kind of things. I'm trying to keep myself lean as possible.
Okay, next question.
Okay.
How many nights do you buy takeaways?
Mostly
in a week?
In a week, only once.
Once a week?
Yeah, or mostly on Fridays. Because I'm just too lazy to cook. Yeah.
Okay. Once a week and it's on Friday.
Yeah. On a perfect day.
So tell me, what does your fridge pantry look like?
Mostly there are a lot of eggs at first.
So a lot of protein.
A lot of protein, like bologna, bacon, then there's some milk, there's some cheese.
So there's a lot of macros and a lot of micros.
Yeah.
You're getting in enough macros. I mean micros.
Micros, I don't think so. Vegetables are not quite my strong suit, to be honest. I don't like them very much, but I know I need them. So that's why I keep some of them there, like potatoes and tomatoes and just some spinach here and there and lettuce. So mostly it's protein, like a lot of macros.
So what percentage of your fridge is protein?
I would say 70%.
70%
Yeah.
protein. Okay. Protein and then
About 30%.
30%.
No, not 30. Yeah, 30% I think. Because, yeah,
Of
with
carbs.
Yeah, of carbs. Carbs is really.
So you have 30% of different, like 10% of fats, 10%. What would you say?
Don't put my what is it? My carbs in the fridge that much, but yeah, fats would be like your cooking oil and stuff. Ne? So my cooking oil, it's not that much. So only less than a percentage because of the amount of food that I have on my fridge. Yeah, so I'll see carbs and other fats would make up all the other 30% that's remaining in my fridge.
That's interesting.
Yeah.
Okay. So next question. Do you have high stress levels?
Stress. Yes, I do.
So how do you manage your stress?
I watch a lot of comedy TV shows. They help me relax, and maybe some stand-up videos of Kevin Hart or maybe Trevor Noah. That helps. That usually calms me down.
Oh, so TV and movies.
Yeah.
Okay. TV and movies. Have you ever used tobacco in the past?
No, not even once. Like nothing. I never want anything with that.
That's good, sir. Are you happy with your quality of sleep?
No, I only sleep about 4 hours maximum.
Why is that?
I think it's because of the high stress levels that I'm having. Like I'm always worried about school and money, which I shouldn't be worrying about, to be honest. But school is the main factor in why I'm stressing.
So, how many nights a week would you say you go to bed before midnight?
Before
midnight.
every night.
Oh, okay.
I don't go to bed after midnight. Not usually though.
Every night you say?
Yeah, before midnight I always sleep.
Okay. Last question, sir.
Okay.
Do you regularly drink large amounts of soft drinks or fruit juices?
Soft drinks or
Soft drinks or fruit juices?
like Coke and okay. No fruit. I drink regularly fruit juices like Oros and stuff. That's my main. That's what I drink most of the time.
So, Oros. And how regularly would you say?
About
How often? Every day? How many times a day? How many glasses a day?
about two glasses a day. But that's when only I drink into my fill of water for the day.
2 glasses a day. Okay. I'll be assessing your medical history to see if you have any diseases and any symptoms of diseases.
This is okay.
So, let's go. First question. Has your medical practitioner ever told you that you have a heart condition, or have you ever suffered a stroke?
A stroke? No.
So it's a no.
No. Thankfully, no.
Okay, next question. Have you ever experienced unexplained pains or discomfort in your chest at rest or during physical activity?
Again?
No.
No.
So I can see you are training every day, and you're training for 2 hours every day. And per week, like if I add all your minutes up,
Okay.
per week it's 960 minutes.
Seriously?
That's a lot. So you're safe.
I'm safe.
You're safe. You're in the you're in the zone.
Okay.
Yeah. So yeah, I just wanna discuss the training intensity and the volume. So if you do a light intensity, your heart rate will be between 40 to 55
Beats per minute.
beats per minute, and then your anaerobic exercise does not cause a notable change in breathing rate, and intensity can be sustained for at least 60 minutes. Okay, and then if you do moderate exercises, your heart rate measures will be 55 to 70 beats per minute.
Okay.
That is somewhat moderate.
Oh.
Anaerobic exercise that is able, and I think that is good for like anaerobic exercise. Okay, so we are at stage 2 of the pre-exercise screening. I'm just gonna ask you a few questions. I just wanna find out, are you in a high risk or low risk, and what current diseases do you have in your family?
My family.
Yeah, your family history, your family medical history.
Oh, okay.
Can you take any medications?
Yeah.
Such things.
Okay. Ask away, sir.
Okay. I'm just gonna ask for your age. How old are you?
19.
You're 19?
Yeah.
Okay. You a male? Just kidding. I'm just asking because you're 19 years old and you're male. That means, and you train a lot.
Yeah.
That means you're in a low risk for any serious diseases like heart diseases.
Okay. That's good, man.
Family, okay, I'm gonna ask you your family history regarding heart diseases.
I have no recollection of anyone in my family having any heart disease. No. So no, my father, my mother, no, my grandfather, or my grandmother, or even before them.
Oh,
Yeah.
Because sometimes if your grandparents have like heart diseases, it can genetically go to you. You know what I mean?
Yeah, from birth, but yeah, I get what you're saying. I've heard cases about it. So yeah, but no, there's no any family inherited disease that we have.
So that's a no.
Yes.
Okay. So, do you smoke cigarettes on a daily basis or weekly basis? Or have you quit smoking cigarettes in the last 6 months?
I don't smoke at all.
Okay, that's good.
Yeah.
Because sometimes the negative effects of smoking cigarettes can last for about 6 months after you quit.
Oh. Yeah, but I think that's for a problem for the smokers then. Yeah.
Yeah, but it's good to know.
Yeah. Yeah, thank you.
Okay, and then your weight?
48.6 kilograms.
It's a good weight, sir.
Good.
It's a good weight, sir.
Oh, I should say so.
How tall are you? What's your height?
168 centimeters.
Okay, 168 centimeters. Okay, then I'm gonna take your BMI. Your BMI. What's your BMI?
My BMI, last time the doctor said it's about 17.2.
Oh, okay,
Yeah.
17.2. Okay.
I don't know what is the doctor always saying, but we went to like medical doing some testing.
Okay.
So they measured our BMI. Last time I checked, 17.2. Yeah.
So what's your waist circumference? Your waist circumference?
Waist.
No, when you check your jeans, when you go in the shops, what jeans are you taking?
I
A 32,
normally-
a 30, or 28?
28.
A 28.
Yeah.
Have you ever been told you have high blood pressure?
No.
Okay. Are you taking any medications for this? No, because you do not have any.
High blood pressure.
Yeah, you don't have any high blood pressure problems. Yeah. Okay. Have you been told that you have high cholesterol?
No.
Okay. Total cholesterol. Have you ever been told you have high blood pressure?
Blood pressure again.
High blood sugar.
Or blood sugar.
Excuse me.
Okay. There's a common mistake, but no.
Ah.
No.
Okay, you're not taking any medications?
Yes. So bless you, bless you.
Thank you, sir. Are you currently taking prescribed medications or for any conditions?
No, no. I'm just no pills or anything right now.
Because sometimes the medication that you take, it can affect the workouts, and it can affect the way you exercise and the way you feel during exercise. So I just need to know
Whether I'm taking
what
any
you're taking so I can know how to
Okay,
how to structure your program.
Or do
Like I would ask a female, are you on contraceptives? I would ask a male if he's on multivitamins.
or do
No.
cold and flu like medicine count? But that's only when I get a cold.
That's only when you have a cold. Have you spent any time in the hospital in the last 12 months?
No. For any injury. For injuries or
It can be for injury. It can be for any diseases you picked up, or for anything you've been through, a car accident, anything like that.
I've been to the doctor.
Fractures, infections,
Just go for
inflammatory bowel diseases, stuff like that.
Nah, just for regular checkups.
Regular checkups, eh?
Yeah, just for regular checkups.
I was gonna ask you if you're pregnant, but you.
Obviously no.
Yeah.
No.
Because during pregnancy, training while you're pregnant can affect a lot of things, you know.
The baby as well, I think. So.
Yeah, you know, sometimes like if you train while you're pregnant and you're like knowingly pregnant, it could increase like health in the baby's health, your health and the baby's health.
Seriously.
And then
In a
like,
positive way.
yeah, and sometimes if someone didn't know that they were pregnant, and then they would train with me, and then it could lead to an injury to the baby, something like that.
Yeah.
You understand?
You can't push them too hard.
Yeah.
Okay, I understand. But that's a question for the females. So I'm quite alright.
Do you have any diagnosed bone, tendon, or ligament problems that could worsen during exercise?
No.
Yeah, and that isn't the type of soreness you get when you're training from unaccustomed training intensity. It's more of a serious injury, a serious inflammation, serious swelling of the joints and
So that might
ligaments.
So that might affect my training.
Yeah, it could lead to a serious injury if you train with
No, I haven't been injured.
any.
Yeah, okay, no, but I haven't been injured ever since I was playing, so I don't think there's any problem with my muscles or tendons.
So, just some follow-up questions about your medical conditions. Do you have arthritis, osteoporosis, or any back problems?
Back problems, osteoporosis? No. Thankfully, no.
Okay, that's good. Do you currently have cancer of any kind?
Like breast cancer or cancer,
Any
like any
cancer.
cancer.
Any cancer.
No.
Any kind. Okay.
No.
That's good to hear, sir. Count your blessings.
I do, I really do.
Do you have a heart or cardiovascular condition that includes coronary artery disease, heart failure, or diagnosed abnormality of heart rhythm? Anything that you have any issue with your heart or
My insides are clean. I'm good. My engine is still fine.
okay. Do you currently have high blood pressure?
No.
Do you have any metabolic conditions? This includes type 1 diabetes, type 2 diabetes, or pre-diabetes.
No. Metabolically, my system is still fine.
Do you have any mental health problems or learning difficulties like Alzheimer's, dementia, depression, anxiety disorders, eating disorders, psychotic disorders, intellectual disability, or Down syndrome?
Learning difficulty? Nah.
Not that you know of.
Nah. That's only focusing for about 30 minutes count as learning disability. Like when I try to study, I can main focus straight only for 30 minutes, then get distracted. Is it a learning disability or not?
I don't think so.
You don't think so? Other than that, no, nothing. No Alzheimer's, no psychotic issues, just straight.
Do you have any respiratory diseases like chronic obstructive pulmonary diseases or asthma, or pulmonary high blood pressure?
Oh, no.
Do you have any spinal cord injuries?
No, I'm good.
Have you had a stroke before?
No. Sounds painful.
Do you have any other medical conditions not listed above that, or do you have answered all my follow-up questions?
Yes.
And what I've gathered here is that you are in a low risk for any heart diseases. So you could start your exercises at 120 minutes for the light. For your light workouts, light training sessions, we're gonna try to get you off at 120 minutes per week and then gradually build up to 150 minutes per week.
My light workout?
Your light and moderate workouts.
Okay. How about my vigorous? Is still at the same level?
Yeah, your vigorous is at the same level.
Oh.
Yeah. And you still be training 5 times a week?
Still.
You'll still be training 3 to 5 times a week.
Oh, man. That's still okay. I thought you would give me extra days.
No.
That would be very harsh on myself.
I'm not that harsh.
Okay, thank you.
I'm more relaxed, I'm not gonna push you like that. I'm not gonna push you like that.
Yeah, because you could injure me in some kind of way.
Yeah, and I don't want you to get injured.
Right.
Yeah, otherwise you'll have to go see the doctor and then come back to me.
And then you might get the blame.
You see?
Sorry.
But so you are old, you younger than 45,
Okay.
and you exercise light intensities to moderate to vigorous to high exercise intensities. So yeah, that's good. If you ever get injured, if you ever get injured or sick, you should go to the professional medical practitioner and then tell me. Yeah, keep me updated with that.
Or it can affect my training.
Yeah, it can affect your training. Yeah.
I'll do what I can. I'll do as best as I can.
Okay, sir. So I'd ask you to sign your name, signature, and date here. So the cardiovascular system is very unpredictable, so you can get a heart attack
Regardless of my health.
regardless of your health. Maybe you've given me incorrect information. I am not responsible for that.
It's my fault for giving you the wrong information in the first place.
Exactly.
Okay. Yeah, I understand, sir.
Okay. Here it says, I understand that the trainer, me, will not be held liable for any injury sustained by the client.
I'm sorry, what does this, what is it?
Okay, this is basically the program objectives and procedures. So concerning your body composition, that's your lean muscle mass percentages and your fat percentages. That's, would you like assessments and exercises or only one of them?
So only one. Okay, maybe when you say
Concerning your posture, body fat percentage, lean muscle percentage.
you're gonna measure how much body fat percentage that I have, and how's my posture as well.
Yeah, I'm gonna measure all those things.
Or then there are assessments.
Assessments. Okay, assessments here. And then regarding your cardiovascular system, your cardio,
My
your
cardio training.
your cardio training, that's your heart and your lungs.
I would like regular exercise.
Regular exercises. Okay.
Yeah.
It's only one of them.
Yeah.
No fitness test for that one.
No.
Okay, and regarding your musculoskeletal,
Okay. What is that actually?
it's your muscle system, your skeleton. You know, it includes strength, endurance, and flexibility.
Oh. Then exercise. Only exercise.
Exercise.
Yeah.
All right. Okay. Then it just says, so I'll be doing assessments for body composition, exercises for your cardiorespiratory, and exercises for your musculoskeletal.
Yes, that's right.
Musculoskeletal. Okay. Here it says, I understand that the trainer, me, will not be held liable for any injury sustained by the client, you.
Oh, this is where I have to.
Yeah, that's where you have to give your name, your full name,
Yeah.
your full names.
Okay. Okay.
Yes. And then I'm gonna be describing the benefits. Now, the benefits of engaging in this fitness program may include an improved cardiovascular system, a decreased risk of non. So the benefits of you engaging in my training fitness program would be an improved cardiovascular system, decreased risk of diseases,
Okay.
an improved muscular and neural system, and last but not least, improved mental well-being and improved quality of life.
Okay, that sounds good. I would like that. But that's only if you train me effectively.
I will do so.
I'll try to do so.
I'll try to do so.
Okay.
I'm going to do so.
Okay.
If you have any questions, you can contact me. My phone number is there on the paper.
Okay.
Can I just get your full names and your signature here and today's date?